special test is called the sideline abduction test. So Hannah is in a sideline position on the couch. What we're doing here is we're assessing, again, the underactivity or perhaps overactivity of muscles on the lateral aspect of the lumbo-hip complex. So we're testing, first of all, for quadratus lumborum, so overactivity in our QL, and perhaps underactivity in our glute medius. So as we abduct our leg, as we know, our glute medius is one of our dominant hip abductors. So we shouldn't really get quadratus lumborum contraction at an early stage of hip abduction. It does come into play, obviously, to then further stabilise the pelvis as the hip comes up towards the ceiling in our abduction. However, it shouldn't be firing first. If it is, it's a positive for an overactive quadratus lumborum, and then your treatment and your advice from that would be to stretch it out. So you might want to choose some soft tissue release, some METs, some massage to that QL, and then a self-stretch for a piece of post-care advice for the client to continue doing that at home. So the test, anyway, is one hand gently on the glutes here, on that glute medius, just on the side, just below that iliac crest. And then on the back, I'll come around and show you from the view the other way in a second. You're going to find the PSIS, walk your fingers up into QL, dig your fingers in, so you're actually on QL, and then slowly ask your client to abduct, keeping the leg straight, up towards the ceiling. So hand gently here, but the hands on the back, into QL, quite deep, really got to get in there. So let's just turn Hannah around, and let's show you from the other way. So, on Hannah, her PSIS is quite easily found here. So QL is going to be just superior to those. Okay, so this is your rectus spinae, and in there is the QL. So dig your fingers in, perhaps you might want to do a thumb, it doesn't really matter. So thumb in, there, this is what I'm going to use. One hand gently on the medius here, and then ever so slowly again, keeping that right leg straight, Hannah. I want you to lift up towards the ceiling. So we've got brilliant medius contraction there, I felt, and then about a second, 1.5 seconds later, we got QL. So that's a negative result. Her right quadratus lumborum isn't overactive, so we wouldn't be needing to treat that in the session.